Welcome to the ESTETICA E30 treatment unit instruction video. Jörg Eberle, our sales colleague, will take you through this instruction video. The patient chair is designed for a maximum patient weight of 180 kilograms. Without instruments, the chair can be moved in 3 ways. The first possibility is with the foot control. If the cross switch is moved in the middle upwards and forwards, the chair is raised. If the cross switch is pulled backwards, the chair is lowered. Cross switch to the left, the backrest moves backwards. Cross switch to the right, the backrest moves upwards or forwards. The second possibility for moving the chair is via the dentist element. With this option, the dental chair can be raised and lowered, and the backrest can be moved forwards and backwards. The third possibility for moving the patient chair without instruments is with the use of the assistant element. The arrow keys indicate the direction of the movement. The ESTETICA E30 can easily be converted from the right-handers to the left-handers model. This function can be selected as an option. Please ensure that there is sufficient room for the chair to swivel. The unit has to be turned off before being converted. Remove the bench. Loosen the swivel screw connection. Swivel the patient part with the dentist and assistant element to the other side of the chair. Please make sure that when swiveling the dentist element and turning the unit itself, the instrument tubes do not get caught on anything. Release the locking and swivel the unit body 180 degrees until the locking clicks into place again. Fully tighten the screw once again. Secure the bench and turn the unit back on. In order to treat the patient using automatic positioning, first move him or her into the approximate position with the corresponding button. Then, employ the manual fine adjustment to take their height into account. If you want to let him or her rinse, you can move them into the rinsing position using the SP button. With the LP button, the treatment unit moves back, automatically, to precisely the position it was in before the rinsing. And you can continue with the treatment. The rinsing position on the right can be retrieved with the foot control, without instruments. The last position can be retrieved to the left. The positions can also be retrieved using the assistance unit. Press the blue button in the middle. The positions can be retrieved as long as the LEDs are flashing. Adjusting the headrest. Loosen the knob. Adjust the headrest. Tighten the knob. The treatment unit has multiple safety shutoffs. On the backrest, at the lower end of the bench, the foot plate, the bracket on the foot switch, as well as on the assistant element. If a safety shutoff is active due to a blockage, a corresponding LED flashes on the assistant element. An exclamation mark on the dentist element indicates the presence of a blockage. When a safety shutoff is active, the chair can no longer be moved. Shock position. In the shock position, the treatment chair moves all the way up and the backrest all the way down. The circulation of a patient who does not feel well during his or her treatment will thereby be stabilized. Please take the following into consideration. The shock position has to be programmed in advance. To adjust the dentist element vertically, activate the joystick. Move the unit to the desired height, and then release the joystick. Programmable automatic positions of the treatment unit. For position 0, we recommend programming the entry and exit positions, and saving an upper jaw and a lower jaw position. The positions can be saved as a function of the practitioner. First, we determine the practitioner. To save an automatic position, move the treatment unit manually to the desired position. Then, press the corresponding position button for 4 seconds. The treatment position is then saved. The rinsing position can be programmed using the same procedure. Adjust the chair manually. Press the button for 4 seconds. Saved. Please note that the shock position also has to be programmed. On the dentist element, a series of functions can be controlled with the red touch button. The treatment light can be turned on or off using the glow button. If an optional KaVo Lux 540 LED treatment light is installed, the second button enables operation of the function, including the CompoSave mode. The X-ray viewer button controls the lighting of the fluoroscope. With the instrument removed, the counterclockwise rotation of the motor can be activated with the red M button. The spray button switches between spray air and spray water. The instrument lighting button turns the instrument lights on or off. To fill the rinsing cup, briefly press the cup button. The cup fill volume is programmed by pressing and holding the cup button for 4 seconds. Then, within seconds, a beep is heard, and the water flows. As soon as the button is released, the fill volume is saved. To rinse the cup, briefly press the cup button. The rinsing duration is programmed in exactly the same manner as the cup fill volume. Press and hold the button for 4 seconds. The system beeps. Release the button. The rinse duration is saved. An additional function can be activated with the bell button. The Connexio button starts the multimedia function. Optional Endo function is activated with the M button. The timer button serves to start and program a timer. Press for 4 seconds. Set the time, then return to the menu. Additional settings can be retrieved using the arrow key on the display. Number of users, cup fill time, bowl flush time, instrument lighting afterglow time, system time, display type, display contrast, menu language, and the firmware version. If an instrument is removed and deployed, a bar displays the performance. If a micromotor has been removed, the rotational speed is displayed. If it's a piezo, the performance. If an exclamation mark is displayed, further information can be retrieved via the corresponding button. The dentist element is also available as a swing arm. The operation of the display corresponds to that of the standard version. Only the orientation of the display is upright. The instrumentation is freely selectable, and the instruments are available with or without a locking mechanism. The version with locking positions has a mid position. For return, pull it lightly forwards and put the instrument down again. In order to reach the front locking position, pull out completely. The swing arm is locked. Pull once again. The swing arm returns to where it was. The pneumatic brake for the height adjustment is located on the side to the left and right. The rotational speed can be controlled with the main pedal on the multifunction foot control. When instruments have been removed, The cross switch in the middle of the foot control activates the counterclockwise rotation of the motor and deactivates it as necessary. The left button on the foot control switches the spray conditions. The right button activates a chip blower. The increased blast of air is sure to remove chips at the preparation site. The chair functions can be controlled without instruments via the foot control. The brightness can be adjusted with the top button on the back of the KaVo 540 LED operating light. Press for 4 seconds. The light first goes on in the dimmest mode, and the brightness then increases by 5,000 lux per second. Release. The setting is saved. The second button is for the setting of the CompoSafe mode. Press for 4 seconds. The light is dim at first and becomes brighter by the second. The lower button enables the switching between CompoSafe and dim mode. If the lower button is pressed and held, the color temperature of the normal treatment light can be set to between 4,000 and 6,000 Kelvin. With the 3D hinge, the treatment light head offers extensive setting options. When the hinge is loosened, the light head swivels sideways. When it's swung back, the light head is locked in the mid position. The light handles can be removed. To remove the handle, press the last button in the upper part. Alternatively, there is a light gray handle that can be sterilized. The Maya LED operating light. It is turned on and off with the programmed automatic positions. There is an additional on-off switch on the back of the light. When the button is pressed and held in one direction, the light is dimmed progressively. The handles, which can easily be removed, can be sterilized in the autoclave. The buttons on the assistant element correspond to the controls on the dentist element. Filling of the cup, rinsing of the cuspidor, light on and off, timer. There is no function associated with the two lower buttons. Please note that there is a separate hygiene video about ESTETICA E30. We recommend that you check the turbine return air filter weekly. Remove the cover below the dentist's unit, take out the filter, and press it dry on a towel. Then, put it back. A tube of silicone lubricant is provided with every treatment unit. It is used to grease the O-ring. It's best, before the intensive weekly germ reduction, to rub a pea-sized quantity between the thumb and index finger, and then to grease the multiflex coupling, motor, and syringe O-rings. Instructions for use, instructions for care, a care and cleaning plan, and brief operating instructions are provided with the treatment unit. The documents can also be downloaded from the KaVo homepage. You'll find all of the contents there for your reference. Please note that there is a separate hygiene video about ESTETICA E30. With the PHYSIO Evo, there is a lever underneath the seat to the front left. To adjust the seat height, raise the lever. The backrest can be adjusted using the back lever. Press down and lock, and the backrest can be moved. Pull back up. The backrest is secured. The lever for the inclination of the chair is located on the right side of the chair. Push the lever downwards. The inclination can be adjusted. Pull back up. Secured. The Evo F chair is equipped with a footplate for the adjustment of the height. It can be operated with the heel. Adjustable when pressed, released, secured. Otherwise, the operation is identical to that for PHYSIO Evo. PHYSIO 1 is a simple version. For the height adjustment, there is a lever underneath the seat to the left. On the right, the inclination of the chair can be adjusted. Push the lever downwards. Adjustable. Pull up. Secured.